Levels of disease, dysfunction, drug dependency, and obesity are at an all-time high, while activity levels are at an all-time low, especially during this time. Hi everyone, my name is Claudia from Ho'olamana, and I'm here to help you become the healthiest version of yourself inside and out. So welcome back. Movement matters. I've been sharing with you 5 things for optimal health. So they're flexibility. You don't have to twist yourself into knots in order to be flexible. Energizing exercises that not only energize your outside, but also the internal spirit of your internal body. Core conditioning, inner unit and outer unit are the key foundations, especially the inner unit, are the key foundations for a strong core. And functional exercises, doing primal movement patterns, push, pull, bend, squat, lunge, twist, and gait. So yeah, I forgot almost. And finally, we're going to talk about special considerations. So what are the special considerations? So sedentary lifestyle, overconsumption of medical drugs, fast food, and eating processed foods, as well as environmental toxicities, are things that can affect your workout program. So what are those special considerations? Okay, first, scales. Okay, so when people are exercising, they like to see how much they've lost and how much, what the scale number is. So a lot of people will see in the beginning that they lose weight, and then after a while, they see that they're gaining weight. So that creates a big frustration for them, not realizing that muscle weighs more than fat. So muscle is denser than fat. So therefore, as you build muscle, you build the density. Building muscle helps with weight loss and fat reduction. So don't let the scales fool you, okay? Another thing is calorie reduction. So a lot of people, when they start working out their program, they reduce their calorie reduction while increasing their activity level. And so the enzymes that help us metabolize our food, basically they decrease our ability to lose fat because of the calorie reduction, and therefore they end up storing more fat that way because the body's thinking that it's starving. And so you want to be able to balance all of that. So cutting calories probably is not the best thing. So eating according to your metabolic type would be great. So eating the right portion, the right ratio of proteins, fats, and fiber is the best way. So whether you're a protein type, a carb type, or even a mixed type, eating according to your metabolic type is going to help the scale. So no pain, no gain. A lot of us have heard that with exercise. However, if you have pain, it will equal to no gain. So you want to know the difference between, having a sore muscles after not working out a while, to pushing yourself too much to the limit and causing stress in your physical body, so you hurt yourself. So rather than no pain, no gain, train smarter, not harder. So realizing that these exercises, by doing compound exercises or compound movements, will help you burn the fat a little bit better. Okay, and what else? So, medical drugs. So make sure if you are taking some medical prescription drugs, make sure you get the approval of a doctor first to see if you're allowed to exercise. Now, once you begin exercising, you might realize that you may have your body's response I'm not saying you have to check with your doctor, of course, but your body will respond a little bit different to a point where maybe you might reduce the medications, and all depends on what medications. So also side effects of drugs. So like for example, beta blockers that are supposed to level your blood pressure down. So, and when you're exercising, if you are taking blood pressure, you might overexert your body because that blood pressure medication is keeping it low. So you want to keep that in mind. So when you're doing that, crunches, a lot of people come to me is like, yes, I really want you to train me. I really want a flat tummy. I want to get rid of this. And of course, if you watched my videos, you'll understand that there are other considerations that might be affecting the paunch belly. But so if you're working on just target exercises like crunches, you're not going to reduce the fat overall. You're actually going to like create more of a body imbalance in your body as you crunch a lot and shorten that muscle, while it's not really focusing on the internal organs and what's going on with the internal organs. So target exercises might not be the best either. So again, compound exercises would be good. Aerobic exercises. Okay, so I love Zumba. It's one of my favorite classes, and actually I'm certified to be a licensed Zumba instructor, as well as Strong by Zumba, Aqua Zumba, Zumba toning with little light weights. So the key is that if you do like aerobic exercises, make sure to switch it up because your body plateaus. Okay, so your body plateaus, and therefore you might see a change in the beginning when you start up a program, and then your body plateaus and you'll realize that it's not working. So try different things in your aerobic regimen. And also with aerobic exercises, a lot of this repetition, if you don't have the flexibility, if you don't have the core foundation, you might have some muscle imbalances, and those muscle imbalances will lead to more injuries. So a key thing to do that as well is not just taking the aerobics classes or the spin classes or things like that, which I believe are all great, but also working on adding resistance training. So adding the weight training, adding those push, pull, bend, lunge, squat, twist, and all those exercises that are important. And change your program, because changing your program, your body will get stimulated. Now, circuit training is what I like to do, and what a lot of people realize when I train my clients in circuit training, they're like, wow, like I'm out of breath. So it's almost like you're getting the cardio, you're getting your heart, you're working your muscles, you're working your endurance for your heart and for your lungs while you do some circuit trainings. You can either also do those compound exercises, to switch it around. So starting from the most complex movements, double joint movements, maybe to single joint movements, or from the large muscle groups to the smaller muscle groups. And let's see. So again, focus on those functional exercises, those primal movement patterns. So next one is flattening abs after pregnancy. So with that, let's see. Okay, yes. Also, I forgot to mention with the circuit training, less is more. So you want to allow your body to recover, and not saying that you have to spend like 2 hours at the gym unless you're trying to build hypertrophy with your muscles and build muscles. That's a different type of training that most of us don't need in order for our activities of daily living or the sports that we are doing. So less is more, and also with exercise, do something you enjoy. So now back to flattening the abs after pregnancy. So what happens with pregnancy is our muscles, our stomach muscles, the muscle fibers. So the muscle fibers, they stretch out, okay, through pregnancy. And after pregnancy, after you've given birth, your muscle fibers, it takes a while, it takes time for your muscle fibers to go back to their normal size. So what happens with pregnancy, if you get pregnant again too soon, then your body doesn't have, those muscles don't have that opportunity to go back, and they stay stretched for a longer time. And so then after, it's harder to shrink those muscles back into their normal size. So also, so with pregnancy, it's also not an excuse to eat anything and everything, because that is also going to affect the internal body. And also with the stretching out, those muscles will stay stretched longer. So now with C-sections, C-section, they cut through 3 layers of muscles, so it actually causes a lot of damage into that area, into the abdominal area, because it's cutting through your core, your deep inner unit muscles, or the transverse abdominis and the external and internal obliques, not just your rectus abdominis. So you want to be able to strengthen, even though it hurts in the beginning, right after a C-section. It takes your body time to heal. And so you want to gradually build up that inner unit strength again. Otherwise, as you go along through life, you'll have issues with incontinence, or not being able to stabilize your pelvic structure, or not being able to recruit your abdominal muscles. So, and what happens is that because sometimes women don't want to feel that pain, it causes the heart bottom syndrome. So rather than having that natural round, round glutes, it's actually, they squeeze it so the hip actually tucks under, and you'll see that it looks like a heart, and so it causes those muscles in the gluteal, the major glute muscles, the gluteus maximus, to stay shut off, and some of the internal hip muscles and glute muscles are the ones that are fired. So, and that also causes muscle imbalances. So, and finally, low back pain. Back pain during exercise may be caused by muscle imbalances. So may be caused by if you have those the not being able to recruit those inner and outer core unit muscles. And so one of the things that back pain during exercise, it's great to address those muscle imbalances. It's good to foam roll those tight muscles to elongate them, and of course to have that flexibility. So if you have a bulging disc, make sure that you go to your doctor. Maybe you will have to get an MRI. Avoid bending forward exercises, avoid crunches, and also make sure that you know where it's at, and adjust and modify your exercises accordingly. Because faulty recruitment of muscles, when we do that, when you recruit your muscles and improperly, then your body adapts to that, keeping you in that level a little bit longer. So those are the special considerations. So if you have any questions, please reach out to me. I'm here to answer anything. If you want tips, if you want information on personal training, if you want information on any of the topics that I've talked about. So hope you're doing well, stay well, and again, as you go out and exercise, take it slow. Make sure you're doing your core muscles, make sure you're stretching, and have a wonderful time out there. Take care.